everyone. Today, me, Medhavi Regmi, and my friend Ankit Mehta will be hosting this show on this notable day of World Suicide Prevention Day. We welcome Mr. Sulav Bista to enlighten us with some information about mental disorders and the need to take care of them.
As mentioned by my co-host, today we have Mr. Sulav Bista with us. Mr. Sulav is one of the main brains behind Nepal Student Association of Psychology. He is also well decorated with multiple awards in the stream of psychology, which includes topping A-level psychology all over Nepal. Individuals like him are vital to a nation like Nepal due to the low standards of mental awareness and healthcare.
Thank you so much, sir, for taking time to come to our show and talk to us and our viewers. Now, moving forward, I would like to start with a very short and simple question. In simple words, what do you think is meant by anxiety, and do you think it's common for us youngsters to face it and to go through it?
Firstly, thank you so much, Navya Nepal team, for inviting me and having me here. I hope this goes to as many as people there are who don't know about anxiety, mental health, depression, suicide. Thank you so much. Okay, and sure. Anxiety. Could you again repeat your question briefly?
So just a little bit, you could tell us a little bit about anxiety, and do you think it's common for us youngsters to go through it? You know, people who are like 15, 16 years old, do you think it's common for them to face anxiety?
Sure. See, anxiety is something that is common for everyone to face. Now, I'll tell you a difference between all these terms. Firstly, I would like to explain what anxiety is. Okay. Now, see, whenever you see a spider or a snake in front of you or near you, you feel anxiety, you feel fear, that is anxiety. Now, let's take an example of our daily lives where we are feeling anxiety daily without any reason, without the spider being there or a snake being there. Now, that is anxiety disorder. Anxiety is good for everyone because if we don't have anxiety while we are missing on a deadline or while we are working on something, we will not be able to finish it on time or be more productive. But if it becomes a disorder, if it is our daily habit, if it disrupts our daily routine, then it becomes a disorder. So it is very common for every individual to feel anxiety. But anxiety, when it turns into anxiety disorder, then there is a problem, and then we need a medical intervention there.
Sam, have you gone through anxiety personally? And if yes, like how was its experience and how did you deal with it?
Yeah, thank you. Sure. The thing is, I'm right now also going through anxiety, not at the particular time, but at the present. I have been battling through anxiety since 4 5 years, but I consider myself being lucky because I got all the support necessary medical intervention, medication, and all the counseling. But there are so many people who don't know what anxiety means. My anxiety is generalized anxiety disorder, so which means you have anxiety with all kinds of things, may it be talking in a public or like facing someone or feeling that you are going to go mad or like you are going to get a disease, like all kinds of things. That is generalized anxiety disorder, and that is what I'm facing through. And trust me, it is not a very good experience to have, since it is a kind of disease, though many people do not regard it as a disease. It is a very unpleasant experience. While you see your friends going to bed at 10 p.m. or 11 p.m. as they like, you are on your bed in your phone, do not have anyone to talk to. You are just like looking at your phone, finding for someone you need to talk to, and just tossing and turning in your bed, needing help, sweat drenching through your body. It is a very bad experience. And the next day you wake up very late, your schedule has been postponed, you have not done a lot of work. So it affects day-to-day life, and it is not a good experience at all. But because of the proper medication and proper support I have been given, I guess the path has been clearly easy for me.
Okay. So now I would like to talk about a different topic, which would be depression. Now, what do you think could be the reason for people to be dealing with depression and, maybe suicide? Many people would want to kill themselves. I mean, suicide means wanting to die and wanting to kill yourselves. And many people think this is just because they want to seek attention, or they want people to hear them. Do you think this is true? Because I completely disagree with it. I think suicide is something completely different, which happens due to your mental disorders, but many people think it's just for seeking attention. What do you think about this?
Yeah, sure. Now, it is depression, suicide. This is all. They have a lot of range of factors. Now, see, suicide can happen not only because of depression. It can happen because of other reasons as well. People who do not suffer from depression may also kill themselves. There are other reasons, but if we talk about depression that causes suicide, there are different types of it. There are different causes of it. Like, there are a range of factors competing against each other or complementing each other that lead to suicide. Like, some people may have some genetic basis for suicide, like their parents or their family members may also have been battling through depression, or may be going through may have committed suicide in the past. So that can be one of the reasons. The next reason may be biological imbalance. So scientists and the research so far have found out that because of some specific hormones like serotonin or dopamine, endorphins, and oxytocin, so a range of chemical factors, if they are less in number, or if there is a disbalance in number, these may also be causing some negative thoughts, negative mood in the person, which may ultimately lead to suicide. And there are other cognitive factors like negative thinking patterns. Some people have the tendency to take everything negatively. So there are a range of factors. Some people take substance like drug abuse, or some people because of that also they may go into depression and then finally go into suicide. So there are a range of factors. And no, this is not true that people like killing themselves. It is because of the condition, it is because of a situation that has been created in the mind, that they finally opt to take their own life. And there is a very bad concept, what perception, that is said, like, people commit suicide. So usually the word commit is known for committing murder, committing death or something, right? But people use this as committing suicide, which is because before committing suicide was known as like a crime and was regarded illegal. So because of that, it is they use this word, which is very difficult to get rid of. But still, we should not be using such terms, because people are not committing suicide. It is not a crime. They are in such a bad situation that they feel like they do not have any other choice than taking their own life. That remains the best and the last option for them. So that is there that those reasons cause suicide, and that is not because someone wants to suicide.
That was very enlightening. So, usually, when we talk about mental health, people think it's only about anxiety or depression, but there's much more to it. So, can you explain the other aspects of mental health care, other
Okay.
than anxiety and depression?
Surely. I wanted to cover this in my earlier speech as well, but I'll again repeat this. I'll again uh, bring this in light. So, see, anxiety, stress, and worry, these three are different terms. People may say, I'm worried, I am stressed, or I have anxiety. So these are three different things. Stress is related to physical things. Worry is related only in your mental aspect. Like, let's say, I'm worried that I may fail in the exam. So that is just a worry in your head. You're worried about something. Now, if someone says, I'm stressed that I may fail exams, that means the person is experiencing physical symptoms rather than mental symptoms. So that is worry. And anxiety is the combination of both worry and stress. So this should be very clear to people. But it is not we can't blame people if they do not know this, because this is a very uh, scarce information that not everyone gets. Even I knew about this just 2 months ago when I was going through an article in APA. So APA is American Psychological Association. Now, adding to that, there are not only anxiety and depression, there are so many other factors. Like, there's schizophrenia. This is another disease. Yeah, these people have hallucinations. These people see things, hear things. These people have some motor dysfunction, that is they may be like having some dysfunction in their body movements. So this is schizophrenia. This is also a very common one in Nepal, but very underreported, because many people stigmatize these people as being mad. OCD, obsessive compulsive disorder, wash my hand. It may have increased during the COVID-19 pandemic, because people have fear of washing hands and things like that. So if you have like, if you wash your hands and if you feel like the dirt is still there are still germs in your hand, you wash it like 3-4 times. Now many people say that they have OCD. No, but that is not true. Like, for example, you want to finish the number, counting number in even number. That is like, if you want to finish in 10, 12, 14, people don't like finishing on 11, 13, right? So that is not OCD. If it affects your daily life, that is OCD. Okay, so it consists of two parts, that is obsession and another is compulsion. Obsession means like, let's say I have an obsession of counting numbers whenever I'm driving. If I don't count, I feel like I'm gonna have an accident. So that is a very bad obsession, because whenever I go to drive, I'll always have that thought in my mind. So because of that, what I feel is, okay, if I don't count, I'm gonna have accident. So there is this compulsion of counting numbers while you drive. Now if this goes on through a long time, it develops into OCD. So that is OCD. And there is another one, that is ADHD. ADHD is attention deficit hyperactive disorder, which means like, there are people who you may see like, uh, like showing erratic behavior, like always talking and like demanding attention, not in a bad way, because of their, it is because of their mental disbalance and things like that. And there are like what else is there? So these 4-5 are more common ones. There are substance abuse disorders, there are gambling disorders, there are, right now even social media addiction is one of the disorders. It has not been classified as one, but it surely is going to be in the or next version of like DSM-5. So DSM-5 is like diagnosis for statistic manual, which is the classification of diseases. And so it is going to turn out there soon. So there are a wide array of diseases, not only anxiety and depression.
That was, we got to learn so much about different mental health problems. Now, since today is Suicide Prevention Day, how important do you think this day being celebrated is? Do you think it's important in context of Nepal or overall around the world?
Yeah, I do believe it is very important, because see, whenever we acknowledge LGBT rights, whenever we acknowledge Women Empowerment Day, or like any HIV/AIDS Day or anything, it is very important, because we are like acknowledging these issues. We are like, okay, we are showing solidarity for these issues. We are telling that we support these issues, we recognize these issues. So it is very important, because it even if we impact one person, and if we can save one life in that single day, it is very important, because people are aware, people know, gain the information that they did not have before. People like to talk about it, because if people say, trends are not good, but I do believe trends are good. If we have a trend of talking about suicide, that trend is good. People are talking about it, even if they are at least keeping in a Instagram story, that is good, because we are being more aware about it. So I do believe this is a very good day to recognize the rights of these people, rights of the mental health issues that people are facing. So yeah, it is a very important day.
So, do you think the resources put into this field on this day are enough by the government and the people? Like what the government and the people are doing right now in the context of Nepal? Is it enough?
Yeah, I got your question. Thank you so much. It's a very good question. I like talk a lot about it. See, if you go and search in Google, is suicide illegal in Nepal or not? It will say it is illegal in Nepal, but it is not. If I was just going through an article today in one of the articles, Nepali media, which said that suicide is illegal in Nepal. I don't want to take the name. See, if one media starts awareing people like this in a wrong way, we are spreading false information. you know Now I'm not saying that it should be the question about being legal or illegal is different thing. That is a different topic. We can discuss it later. If we say that suicide is illegal, people are not going to report their suicide cases, thinking that they are going to be get punished. So because of that, we are not getting an accurate data of people who are committing or attempting to commit suicide. Okay, so there are people who are awaiting like mental health professionals, or in their personal blogs or scientific journals. People are there who are spreading false information without knowing themselves. If you go in Muluki Ain, it has straightly mentioned that if anyone commits suicide, there should be a procedural investigation, but it does not criminalize it. That is very important. Now, talking about the steps and measures taken by the government, no, it's not at all adequate in the present context of Nepal. If you see, I do not have the proper data, but if you see any data, it is like very less, not even a significant amount that government distributes or allocates its budget towards mental health issues. Very less. And if we do not do that, people are going to suffer more because of the stigma, because of the fear of getting punished. And if government does not take any action, we are still going to fall very behind. I just viewed a YouTube video of Bill Gates, which which presented Nepal as a good healthcare provider in terms of child infant mortality rate or something like that. That is a good thing, but we need to start investing in mental health as well. Now, I was going through an article today. I was going through an article of Dr. Pawan, who is a very good researcher in Nepal, because there are very less researcher working in Nepal. Okay, and I found out that Nepal government has not been taking any good measures, like no adequate mental health hospitals, no good professionals, and very less licensed CBT workers. If you see the data in other countries, they have an accurate data of how many people have committed suicide, how many people are suffering from mental health disorders. But in Nepal, there is no particular data about suicide rates. There are only police records, and which may be widely underestimated, because see, why I told you, right? The suicide seems illegal to many people. Because of that, they do not report, and that may lead to inaccuracy of data. Now, there is this particular organization called Central Bureau of Statistics, if you have heard of it. All the organizations like NGO, INGO, or like district level organizations, all these submit their data to CBS, Central Bureau of Statistics, which finally makes up official data for mental health. Okay, and this CBS needs to provide this data to WHO. But the main surprise is it has not provided any data to WHO. I just found this data in the morning. It has not provided any data. So this kind of irresponsibility, the sheer amount of disregard for mental health, is prevalent even today in Nepal. So these kind of things, this kind of attitude will not let us move forward with mental health. So I believe government is not in track to do anything about mental health, and we need to do more from our side, rather than waiting for the government.
Indeed, we should. Earlier, when I was looking at the laws and things the government is doing for mental health, there were very less and very few things I was able to find. Even when it comes to suicide rates, I was trying to find them, but there is no information except given by the police, which the government should really start working on. Now, do you think mental health is as important as our physical health? For example, physical diseases like maybe diabetes, heart pain, or heart attack. Do you think such diseases and mental health diseases are equally important and they're equally needed to be taken care of?
Yeah. Now, see, your mind, isn't it a part of your body? It is, right? If you see, your brain consists of takes more than like what, 50% or something more water or more nutrients than any other body parts. Why? Because your mind regulates all the body organs. If your mind stops working, what will happen to your physical health? See, your mind is very important as well. Now, I remember my time studying health, population, and environment in my school gems, where we used to, from class 6 itself, we used to study about different diseases. I saw measles, I saw what, like tetanus, I saw like HIV and all these diseases there. But there was not even a single disease. I did not find depression, anxiety, schizophrenia, OCD, any of that. From there, we can know how underestimated mental health is. When we define disease, it is said that it is not only the presence of a, like, of anything. It is also not only physical, mental, social, and what. So all this kind of definition is provided by WHO. But why don't we study this in our school and in our books? That is a irony in itself. So I believe it is equally important to mental, physical health, since if your mental health is not good, your physical health will never be good. In Nepal, in the context of Nepal, women are more likely to suffer from men, and commit suicide and suffer from depression and things like that, because see, there are a range of factors. Women face more social hardship than men. They are suppressed. They have poor empowerment. We do not empower women a lot in Nepal compared to other countries, because of which their views are suppressed, their choices are suppressed. They have lack of education, not in urban areas, but if you look at some far western regions, or like some western regions, or rural areas, women get less education than men, because of which they face more suppression of they face more lack of education, suppression, and ultimately get into the mental health problems. Similarly, there is like child marriages. So if people are, when you are at the age of 10, 11, and you are asked to marry as a young girl, you have a lot of burdens, you have a lot of responsibilities at such young age, because of which you may ultimately go into depression as well. So these are very sensitive issues that should be taken in mind, and we need to support women equally like men. So women empowerment also intertwines with mental health issues. And the third thing is uh, the second thing is, we need to recognize the risk factors, like, so if we do research and if we find out, the past researchers have found out that past suicide attempts and presence of mental or substance disorder, impulsivity, financial or social burden, especially in the pandemic, can lead to more people committing suicide. Right now, we are going through a very harsh pandemic, and many people have lost their jobs. So because of that, many people face more problems, more mental health problems, and they are more likely to suffer from depression.
So this will be the last question for today due to time limit.
Sure,
Um,
sure.
we often find that people suffering from depression are also suffering from anxiety and vice versa. So people often interrelate them like they're similar thing. Can you specify like how different they are, and can people suffering from can people suffering from anxiety also commit suicide?
Yeah, sure. Now, what happens is, these things are like, very intertwined, they are entangled with each other. Uh, Depression is about feeling sad, feeling, see, normally if you feel sad, that is good, because you need to feel sad at some times, because it is healthy. But if you feel sad for a long period of time, for example, 6 months, it is not good. Your body is harmed, your mental health is harmed, and ultimately you go into depression because of that. It is a prolonged feeling of sadness, hopelessness, feeling of discouragement. So that is depression. Now anxiety is like feeling vigilant every time, feeling that something bad is going to happen to you, something wrong is going to happen. So that is anxiety. These are quite distinct from each other. Sorry for, but still these two things can happen together. See, I'll give you an example. If you are having anxiety for 4, 5, or like 6, 7 years, now you may think, okay, I'm not going to be fine, or I'm not going to be okay for a long time. And then and at that time you develop a hopelessness. Now that may lead to depression. Okay, now at the same time, if you are having depression, you feel okay, nothing is going good, nothing is happening, and you may be getting some diseases because you are not eating more, you are not interacting with people more. Because of that, you may also develop anxiety that okay, everything bad is happening to me, nothing good is happening, I think I'm gonna die or something. So that may happen. I told in my previous video that like anxiety people who have anxiety, they do not commit suicide, but that is wrong, because we need to upgrade ourselves with new information. At that time I said that it happens, but with majority of people anxiety, they will not commit suicide because they are afraid of dying, so that is the reason they do not commit suicide. But if let's say at a point they feel like okay, now this is it, I don't want to face this at all, I want to die, then at that time they may commit suicide. So we need to be very careful with people like that. So yeah, I do believe that these two things can happen together, and people with anxiety may also commit suicide at a point of time, if it exceeds beyond their limits.
Okay, well, there was a short question I would want to, ask
Sure.
again, even though there is time consumption, but still. So during this time of pandemic, I have seen that there have been so many people committing suicide, and especially women, and they're jobless and they go through a lot of mental health problems. Do you think there is any way they can, overcome that, or even while staying home? They're locked up with their own thoughts. Do you think that the helplines provided by the government, or the few psychologists you can actually talk to, do you think it's helpful for the people? Because right now anywhere you see, they're jobless and they're suffering from depression, or they don't know what to do. So what do you think could be done for these people, or what do you think, how do you think those people can overcome from depression or anxiety or anything?
Yeah, right now people new people may be suffer from depression. Some Mostly people may be suffering from low what mild depression, that is like not a major depression but like a mild depression. They may be suffering from that, and it is very crucial that we identify it early, and then take help from medical professionals. Now the main thing I would suggest is like people need. So when I when one of my videos was published in YouTube, and many people talk to me saying like I have this, can you help me? Now I said like, see, I am just someone like you who is suffering from anxiety, I cannot help you. You need to go to a professional, not to me. You just need to visit them. Okay, that is the thing you need to do. So that is one thing. Now the problem in Nepal is that there are very few psychologists, and even who are present, they charge a lot. They are not very experienced. Okay, they are good professional, I do not deny that, but there are people who are like they charge a lot, but they do not seem to take care of their patients. So that is an issue. Now let's say if I go to a psychologist and take the psychological counseling, they are going to charge like 1,500 to 2,000 for an hour. Now for a patient to be okay, they at least need 1 month, 2 months, or like 3-4 months of counseling. Now average Nepali will not be able to like afford that amount, like 2,000 or 1,500 per hour. It will be like around what, 30-35,000 a month. So that is very costly. Now one good thing is that they can opt with medication. Now medication can be a very good way, but that is should be the last resort, because it has a lot of side effects. It creates a lot of bad effects in our body, which may not be good in a long term. So for now they can take medication as well because it helps them. But in Nepal it is very difficult. Unless government takes any steps, or if any medical professionals take any steps, we are still gonna fall behind. We are gonna get we are still gonna uh, commit suicide in a higher rate. So I believe like there should be some steps should be taken by more psychologists and government, because we ourselves cannot do anything. And I at last I want to say something. Okay, I have a few suggestions of my own. So see, if I want to know about depression, anxiety, anything that is in mental aspect, I cannot just know by seeing you, right? I should I can do that just by researching. So research researching heavily in Nepal is very much important, because there is very less research right now in Nepal. Similarly, there should be more, psychologists in Nepal. Like, people do not know about this, but let me add this: they are not only clinical psychologists. So when people talk about psychologists, they think that someone who gives them medicine or someone who counsels them are psychologists. No, there are organizational psychologists, there are criminal psychologists, there are like psychologists who work in public policy. So those kind of psychologists are more needed in Nepal, because I believe there are not even a single psychologist that I know of who work in public policy, hardly. And there should be more discussions like this to increase awareness. And if we do these kind of steps, then obviously we will surely, like, control the rate of suicide in Nepal as of now.
Now we would like to come to a end to the show. Thank you so much, sir, for coming with us and talking to us and answering our questions. This was a very interactive session, and since today is World Suicide Prevention Day, we've also linked few helpline numbers on our YouTube channel on the box below. So if anyone here, any of the viewers think they're going through depression or anxiety, then they should contact them and they should talk to them. So, like this, we would like to come to an end to the show. Does my co-host Ankit want to say anything?
Yes, it's very important to share awareness, spread awareness on this topic, and I hope this video does exactly that. Uh, and I would like to thank Mr. Sulav for making time to come to this show and talking to us about this topic. Thank you.
Yeah, thank you so much, Navya Nepal team, again for inviting me and for this fruitful, productive session. At last, I would like to say to all these people that, see, right now we are going through pandemic, and people are saying you to be socially distanced, but don't do that. Be physically distanced, but be socially connected. Talk to your people from Instagram, messages, Facebook, anything. Be connected, because that helps. Whenever you share, it at least gets reduced by half of it, and you are gonna feel better. So just connect with people through anything you want. Thank you.